Welcome to Beyond the Razor Wire Fence. I'm Kelly Sheard, the director of the Gender Wealth Institute within Women's Way. Our mission is to advance gender and racial equity by building collective power to disrupt systems of oppression and strengthen alternative models centered in inclusion, love, and liberation. Over the last 7 months, Women's Way facilitated a narrative change fellowship with 7 women and gender-expansive individuals with experiences of incarceration and reentry. With help from Love Now Media, our fellows honed their storytelling skill set to advocate for economic equity in Philadelphia. This podcast centers their stories. Beyond the Razor Wire Fence asserts that incarceration is a form of wealth extraction. Moreover, through this podcast, fellows depict the disproportionately deep impact for women, trans, and gender-expansive people. The fellows' stories dive deep into how the carceral system perpetuates the gender wealth gap and calls attention to the institutionalized strategies of extraction before, during, and after incarceration. Through a combination of interviews, storytelling, and research, the fellows challenge assumptions around incarceration and advocate for a shift in policy and culture to move us closer to a liberatory economy. This episode features Monique Taylor. We'll hear from her, listen to her in conversation with our friends from Love Now Media, and finally we'll welcome Carol Thomas from Project Home, who will sit down with me to add context to the terminology and information introduced by Monique. Welcome, Monique. This episode contains mention of substance abuse disorder, mental health struggles, and the opioid epidemic.
Hi, my name is Monique Taylor. I am a special initiatives outreach worker for Project Home in the city of Philadelphia. I primarily work in the Kensington community, which is the Opioid Epidemic Center. I grew up, I had, my mom, my dad, I grew up on a farm. And when my parents divorced and we moved away from my dad, I started to see depression and, being sad all the time. And I went into using drugs to escape the abandonment that I felt that my dad had just abandoned us. And growing up was really difficult because, we went from one place to another. It was another environment, new people to me, and I really didn't have the experience or the socialization with other people because I grew up on a farm. And when we moved into the city and my addiction took off, I could see my family kind of struggling, the gender wealth gap had already set in when I was young. My mom, we didn't have a lot of the luxuries that we used to have, and we didn't have a lot of the necessities. So as my addiction escalated, I got into drugs and introduced into the prison system. When I was in the prison system, I was away from home. I was then in Philadelphia. Didn't have the access to the bare necessities like soap and sanitary products in the prison. And when I would ask for help at home, my mom, she really didn't have it. She had my children, her grandchildren, and she was a single parent at the time. So, I hustled in the jail. I went to work, and for $20 a week, I used to have to make my ends meet with just $20 every 2 weeks. And while I was in jail, I started to realize a lot of the women that were there were either returning back into the prison system for either a parole violation or a probation violation. So I could see that this system was designed to keep us coming back. coming back in. I never went back into the prison system with just a new case. It was either a parole violation or dirty urine or something. So my call for action is more support in the prison system for women that need support with substance use disorder. I am a person in long-term recovery. I celebrate 9 years this June. I work in a community that has been ravished from opiates, and I see that there are support systems there, but we don't know how to navigate to get to them. So I think that we need more people with the lived experience, like myself, that know how to navigate in the system, prevent people from being incarcerated because we have substance use disorder or a mental health concern. It can be very, very challenging in the prison system where they don't treat the trauma or the support. They just aren't there. It's you do your time, you get out, and you're on your own. And I think that if we start before we get into the prison system, then there wouldn't be a need for the prison. Thank you.
Hi, I am Nicole Blackson with Love Now Media, and today I will be speaking with fellow Monique Taylor. So let's chat a little bit. You talked a lot about the gender wealth gap, and you took us all the way back to your childhood of how you saw it kick in then when you went from a 2-parent household with your mom and dad to a 1-parent household with just living with your mom. Can you fast forward a little bit and tell me a little bit of those details of when you were in the carceral system and you saw that when your mom had to take care of your children, you needed more help and you couldn't afford to get the bare essentials while you were in the carceral system. You said you worked. How much did you get paid?
Yeah, $1.50 a day. So it was like $22.50 every 2 weeks.
Every 2 weeks. Yeah. And what could you get with the $22.50?
Not much. Like I could, get my necessities first. So like a bar of soap would be like $1.50, $1.25. And then they would have caps on like how much you could buy of this product. So once I'm finished, like getting my necessities, if I could get, some oodles and noodles or, something prepackaged, cheap, I would buy it.
Yeah. I think that's something to put a cap on what you can buy with your money that you earned.
Yeah.
Yeah, it's something. So also thinking about your story in regards to just like when you were home and you said you turned to substance use.
Yes.
And you struggled with that for some years, but you also saw that there were a lot of other women who were in the carceral system who struggled with that. How would you want the perception of those people to change?
First, stigma.
Mm-hmm.
Stigma is powerful.
Yeah.
It really is. Stigma is something that you could persuade somebody's, vision with stigma. So like I'm telling you, when I went into the prison system and I seen most of the women had some form of addiction like me, I was like, well, where's the programs at?
Right.
Like, where's the meeting at? Where is the 12-step self-help groups at? And we didn't have any. So I would want people to look at us like people that have a way out and there is a way out, but can't get to the way out. It's easy to say, oh, I have this, this, and this. But how do I get this, this, and this from you?
Right.
Because we have lots of organizations with lots of things in place, but getting to them, it's like, hoops of fire.
Yeah, so what I'm hearing is like the accessibility to the supports as well.
Yes.
And that's why you're inside, but also why you're outside?
Yes. So while we're inside, there's really no supports. You know, you get all these pamphlets and posters on the boards in jail as you're walking down the hallway. They say, oh, we have this, we have that. But then when you get out and you try to access the things that they had, it's like, oh, do you have insurance? You know, do you have an opiate addiction as opposed to a crack cocaine addiction? So they try to like start separating the drugs.
Yeah.
And you can't separate the drug because the drug does not have any prejudice. It doesn't care where you come from, what you look like, you know, what color you are, what gender you are. It doesn't matter to the drug. So we have to take that concept on, like, it shouldn't matter to us. If you want help, we want to be here to help you.
Yeah. So what made you go into this line of work? I know you say you work in Kensington, and you're working with people who are in recovery as well.
Yes.
What made you go into this line of work?
Because it takes one to know one.
Mm-hmm.
So going into the Kensington community where people are actively using, it takes a lot of courage. You know, especially for someone like myself, I am in long-term recovery. But like I was explaining to someone, sobriety and recovery are two different things.
Please explain that.
So sobriety are people who actively don't use. Recovery is for people who don't use and work on their behavior. So I had to work on me. You know, it was easy for me to want to help other people, but I needed help.
Yeah.
You know, so I had to help me to help you.
Yeah.
You see what I'm saying? So in the Kensington community, I love my community. I love everything about the community. Even though, yeah, it's ugly, you know, you see drugs ravishing. It's nothing like it.
Yeah. Yeah, it is, just like it moves you to tears, it is something that leaves me speechless at times when I see it. It almost looks like a zombie apocalypse of sorts.
Yeah.
Where people are not able to just kind of walk upright, simple things, talk, you know, just move with some fluidity. It is something to see.
Yeah.
Yeah, it really is. So thinking about when you said, you know, you just had to start working on you, can you tell us the time where you realized, I got to get more together?
I'll never forget the time my mom had been diagnosed with stage 4 lung cancer. So that kind of motivated me to want to make her last days where she could be free from not feeling like she failed with me. You know, like, it's nothing like having people who love you, want to help you, but you have to help yourself first.
Yeah.
And then you can get all the support that you want. But this is not for people who need it. Recovery isn't for people who need it. Recovery is for people who want it.
Yeah.
You know, and like, I needed a lot of things. And I wanted a lot of things. But I don't see any greater fight than to fight for your life.
Yeah, absolutely.
This is the best fight I've had.
Yeah.
You know, like, I'm so worth it. And the people that suffer substance use disorder, they have to realize that you're worth it too.
Right.
You know, so.
Yeah. You mentioned your mom a lot, and I know a little bit because we've been in conversation.
Yes.
What are some of the lessons that she taught you? Or the encouragement that she gave you that you would want to tell the people in Kensington?
Like, one of the good things that I can say I learned from my mom is, you know, people can walk with you, but they can't walk for you. You know, and like, I will be willing to walk anywhere with someone as long as they're walking with me.
Yes.
Like, my job is not a job if people don't allow us to help.
Right.
And like asking for help is not an easy thing to do. Like we always say, well, why didn't you ask for help? Well, if it was that easy, I would have asked.
Yeah.
You know, it's really a skill. It's something that you have to learn to do because we're so self-reliant and self-willed.
Yeah.
You know, so
What are some of the things that you think get us to that self-reliance?
just our humanism, like just you know, self-willed.
So let me say this. So when you say like we are just conditioned to be so self-reliant and to be so self-willing that we have a hard time asking for help. So what gets in the way of us asking for help?
Our ego, our pride, you know, shame, you know, the guilt of like usually when we have to ask for help, for most of us in the world that I come from, it is from a behavior that needs to be consequences for it. So like, you know, begging at the mercy of the court.
Yeah.
You know.
Yeah.
And so like I never felt like I should have to ask for mercy from the court. I'm suffering from a disease.
Yeah.
Like
Yeah.
I'm sick. You know what I'm saying? Like, and in the beginning of my addiction, substance use disorder was not a disease. You know, so like you always gonna go to jail when they didn't look at it like that. So like, where is the support and the help in that?
Yeah.
You know, you locked me up, but yet you say I'm the one who's sick.
Right, right. So with the design, with women in mind, and with those who are experiencing substance disorder, what would be your call to action?
Oh, I have so many of them, but my main...
Give me your top three.
My main call to action is if there is some form of consequence for the behavior. So like most of the women that I know that are in substance use disorder, they street work. You know what I'm saying? And they go hand in glove.
Right.
So like how do you remove them from the street, but you don't help them with the addiction? So like it all boils down to something had to happen, just like for me. My parents got divorced, my depression set in, I couldn't identify with it, used drugs, so there's some form of trauma here.
Yes.
And we need to start opening up the floodgates so that we can address these traumas. Because
and not just treat the behaviors.
Yeah, for everyone is different.
Right.
So like, if we don't work on addressing traumas and mental health and having access to support systems where they're not weeding us out because we don't fit this criteria, we don't fit that criteria, and making it inclusive.
Right.
You know, we see another concern of mine was in the LGBTQ community, how we see more people in the T category, the transgender people, black and brown, have the highest rate of suicide, have the highest rate of substance use disorder. So we're starting to see that this is bigger than what we thought it was. You know, Kensington is just a symptom of a bigger issue.
Yeah.
We can't always treat behaviors, but we can always help treat the people that are suffering from their behaviors.
Yeah. Thank you so much for joining me today.
Oh, thank you,
I appreciate
Nick.
you always.
I thank you too. Have a nice one.
Thank you.
A note of context from Women's Way. Medication-assisted treatment is a research-backed gold standard of care for opioid use disorder. Typically, there are 3 medications used to treat OUD, or opioid use disorder, and they have been shown to be safe, feasible, and effective in reducing overdose deaths as a part of a long-term treatment plan. While Medicaid can pay for medication-assisted treatment for someone who is not incarcerated, federal law prohibits Medicaid from paying for this treatment while someone is incarcerated. This is known as the inmate exclusion. Treatment and recovery services can be the difference between life or death for those who have opioid use disorder, and the time period after incarceration can be an extremely critical time frame in the reentry journey. One report from the U.S. Department of Health and Human Services says that mortality among returning community members is significantly elevated in the post-release period, especially in the week after release, when overdose, suicide, and homicide are the leading causes of death. For those incarcerated folks who are returning home, they may face challenges such as inability to access and afford treatment, bureaucratic hurdles to reinstate Medicaid or apply for Medicaid, limited health record data sharing between carceral institutions and health providers, and the pressing needs to find housing, food, and employment upon release. Hello, my name is Kelly Sheard. I'm the director of the Gender Wealth Institute within Women's Way, and I'm very pleased to be joined here by Carol Thomas, Director of Strategic Initiatives and Supportive Services at Project Home. Welcome, Carol.
Thanks for having me.
Yes. We are really appreciative to have your expertise and your experience to give us some context into the stories that we're hearing. So I wonder if you can start off by talking about the connection between substance abuse and women who are incarcerated. How are they related?
Well, I'm going to start with a statistic. So in 2023, 72% of women were identified who are incarcerated as having a diagnosed substance abuse disorder where they fit the criteria. And now, the latest statistics, they have gone up to about 85%. And when you look at that, the correlation is so clear. Substance use actually impacts women in a very different way. And it's often survival, it's often desperation, it's poor judgment because they're caught up in the cycle of addiction. And when you compare that to the male statistic, only about 62% of men have been diagnosed with a substance use disorder. So it really is a devastating impact on women.
Thank you for that. What are approaches for treating substance abuse disorders that do not involve incarceration? And how do you think we should treat community members who harm others as a result of their addiction? What should we do?
Well, there are multiple approaches. We have in Philadelphia, which has been part of the restorative justice, as well as putting participants first in the behavioral health system. They have shored up the system so that there's options for outpatient, intensive probation, inpatient. We have psychotherapy, as well as a focus on CBT, which is cognitive behavioral therapy, along with dialectical behavioral therapy, which are evidence-based practices that help women who are in the throes of their addiction, and especially help women who are incarcerated. So, and those folks can also, before they even get incarcerated, can be in pre-trial status, where they have options to get into these programs that can help them maintain family stability and community support. So there are multiple approaches, but they're not always easy to access for people.
Why is that? Can you talk a little bit about that? Why is it hard to access these multiple approaches?
We really don't do a great job on having a clearinghouse where people know about all these services. So unless you or working with a social worker or a social service organization or even a peer organization that knows how to access the services, know they exist, there has always been a disconnect. And we are working on that with wellness fairs and various fairs, but you have to bring the people in. So if someone's in their active addiction, they'll walk right past the fair,
Right.
unless there's some motivation to come in. And the second part, you talked about what should we do with community members who hurt? You have to define hurt. So what does that mean? Does it mean that if you went and you broke in a house and took the pipes out or robbed somebody and you just robbed them and left? Yes, it's a terrible thing and we don't condone it. But that's not hurt on the level that a violent crime happened. So you have to really look at the individual and you have to look at the circumstances, and you don't put everyone who's under the influence in the same place. What you find is you have to listen to stories. And I had that experience. For 18 years, I oversaw a licensed drug and alcohol referral program for men coming out of prison. And they would always say, oh, you can't take anybody who is an arsonist. And I said, an arsonist? And I said, I'd like to go to prison and listen to people's stories. I wanted to do the interview and not leave it up to a courtroom worker who said, this is an egregious crime. And almost every arson crime had to do with the person smoking crack in an abandoned building and accidentally set it on fire. That is not arson. That is not an intent to harm. So I asked the court, could we start taking them? And I asked my staff as well as myself, can we go in and interview people? We needed to hear the stories. We needed to hear what the individual has to say about their life. Because once you're incarcerated, you're sitting there and you can't help but think about your life. But oftentimes people in the throes of their addiction don't have insight into the harm that they have caused. So if it's a no harm hurt, I mean, it has some harm, but there was no violence, I think people should be given the opportunity to have the opportunity to go out and get help, to work on their addiction, to work on their behavioral health, which is substance abuse and mental health. So we need to give people choices and options and also educate them about those choices and options. And I can speak to if someone has engaged in a violent crime, there should be consequences for their actions. And having worked in the forensic system, there were people who came out and had to be sent back because of behaviors of continued criminal activity, not continued drug use, but criminal activity. So you have to make the distinction.
It sounds like the time and space to reflect and understand nuance is important when thinking about what's the right approach for helping someone with substance abuse disorder. And the carceral system is not always the right approach, but we need some space to be able to consider that, which is important.
Absolutely.
One last question for you. What is the one thing you think community members should understand as we think about creating healing conditions for folks who are returning home from incarceration?
when I looked at that question, it's very hard to pare it down to one thing. Mm-hmm. But if I had to, I would say that we need to have a system that embraces people for who they are. They are returning citizens. They are our mothers, our sisters, our cousins, our friends, our lovers, and acceptance. There's so much stigma with having been incarcerated. I don't use the word offender because, okay, you committed a crime. You also have been incarcerated. You did the time. You are now a person who is returning to the community. And if I could do one thing, I would have peers. I would create a peer program for every person who is coming out of our county jails. Right now, we only have 363 women incarcerated in the county system in Pennsylvania. We can absolutely create and put money to good use to create peers, to create a peer support network to help people make that transition that is so hard.
It sounds like we will heal in community, and I thank you for reminding us of that. I wish we had more time to take a deeper dive, but I appreciate all your expertise. Thank you, Carol.
Thank you for inviting me.
Thanks for listening to Behind the Razor Wire Fence. This podcast is brought to you in collaboration with Women's Way, Change the Narrative Fellows, Love Now Media, and Little Drummer Boy Recordings.